Hi, Peter.
Hi. Hi, Sharon.
Good to see you.
Good to see you. Yeah. Hi, guys. There's a camera there. You don't know that.
So the vision of the Doherty Institute is to improve health globally through discovery research and the prevention, treatment and cure of infectious diseases. We focus on research, education and public health, and we're an institute that has end-to-end capability in response to infectious diseases.
The other part of the vision is to do absolutely top-class science and to provide a first-class service to the Australian community. We do the job that has to be done of finding out new stuff.
We're very passionate about discovery research because discovery research are the amazing things that we find in nature that ultimately lead to better outcomes for human health. So we're very active in education and training.
Because of our wonderful situation with all the hospitals so close and such tremendous expertise in those hospitals, much of our program is moving more and more into human systems. We have wonderful collaborative interactions between the basic scientists in the labs, the clinical healthcare delivery people, and the MD, PhD type scientists who are doing really important research. COVID, it was just an illustration of how good this model of bringing the clinical and the diagnostic and the basic science together.
Collaboration is really key to what we do here. The whole vision in creation of the Doherty Institute was to get people from different disciplines to work together on big problems.
It's essential that we collaborate. We collaborate within our institution, across this campus, across Australia, and internationally as well. Everything we publish and we do goes globally because that's the nature of science. It's a global activity.
We are very conscious we need to be even better prepared for future pandemics, and we're doing a lot to address that. We've also got an amazing opportunity through the coming Global Centre for Pandemic Therapeutics, a new research centre embedded within the Doherty, and finally Doherty Clinical Trials, a new clinical trial facility that does phase 1 clinical trials of infectious diseases. What I've found has been remarkable over the last 10 years has been the ability to collaborate with people outside my direct area of science. Much of our success as the Doherty Institute I put down to our people, commitment to excellence and an amazing enabling environment here surrounding us in the Melbourne Biomedical Precinct. We can't do anything without a partnership with the community. It will help us communicate what we do to the public. It helps us design and identify what's really important.
The more we can talk to people, our people can talk to people, talk to the general community in language that people understand, not telling people things, showing people things, doing that through modern technology. Obviously, I'm enormously proud to have my name associated with this institution and with the extraordinary science that it does and the extraordinary people who work here.
So thank you, Peter.
Well, thank you, Sharon.